Dermatophytosis or tinea or ringworm is the most common superficial fungal infection caused by a group of fungi called dermatophytes. They can infect the keratinized tissues of the body like the skin, hair, and nail. The dermatophytes include Trichophyton species, microsporum species, Epidermophyton species. Trichophyton infects skin, hair, and nail. Microsporum infects skin and hair, while Epidermophyton infects skin and nail. They are classified as anthropophilic, zoophilic, and geophilic depending on their habitat. Anthropophilic dermatophytes exclusively infect humans, zoophilic infect the animals, and geophilic are isolated from the soil. Moist skin favors this infection. Dermatophyte infection results in the formation of a well-defined, ring-shaped, pruritic, that is itchy, scaly skin lesions. These lesions have central clearing with raised edges and it grows in a centrifugal pattern, that is, away from the center. First, it attacks the lateral and the superficial nail plates and then spread through the nail. The dermatophytes can cause endothrix or ectothrix. In endothrix, the arthrospores are formed in the hair shaft, while in the ectothrix they are found surrounding the hair shaft. Various clinical types of dermatophyte infections are produced based on their site of involvement. These include Tineacapitis. It is the infection of the scalp and may result in alopecia. Carrion, which is a painful pus-filled swelling on the scalp, or Favus, which is characterized by cup-shaped yellowish crusts that are formed around the infected hair follicle. Tinea faciae, infecting the face. Tineapedis affects the web spaces between the toes. Tinea corporis causes infection of the skin on the trunk and limbs. Tinea barbae causes infection of the beard area. Tinea unguium causes nailbed infection. Laboratory diagnosis. Depending on the site of infection, appropriate specimens such as skin scrapings, nail clippings, or plucked hair should be collected. Direct microscopy is performed using 10% KOH for skin scrapings or hair and 20 to 40% for nail clippings to digest the keratin, and fungal hyphae are clearly seen under the microscope. Seborrheic dextrose agar (SDA) is used as culture medium for the growth of dermatophytes. A lactophenol cotton blue LPCB mount is performed to study the culture morphology. Fungi contain two types of asexual spores or conidia, namely macroconidia and microconidia. Trichophyton produces pencil-shaped macroconidia and abundant microconidia. Microsporum has spindle-shaped macroconidia with rare microconidia, whereas Epidermophyton forms club-shaped macroconidia and microconidia are absent. Other diagnostic methods include hair perforation test, urease test, dermatophyte test medium, and molecular methods like PCR. Antifungal drugs like terbinafine or itraconazole or ketoconazole are used in the treatment of ringworm.